I knew that I always wanted to go into nursing, and I was really drawn to the critical thinking and autonomy that comes with being a nurse practitioner. All the nurse practitioners that I know and all the nurses that I know have some kind of credentialing from ANCC.
Most of us come into nurse practitioner program as expert RNs, and then we start all over again, and we're back in that novice role. There's a level of confidence that a practitioner gets when they pass an exam, especially one that is so comprehensive as the one that the ANCC offers.
Well, we probably know a lot more than we realize as RNs. But then when you become the nurse practitioner, the buck stops at you. You're the one now who has to take all of this information and synthesize it into a plan.
ANCC is the largest and most prestigious nurse credentialing organization in the world, and we're able to use our vast resources to address your individual needs. We offer APRN initial certification in a broad range of nurse practitioner and clinical nurse specialist fields. Certification is especially important to APRNs because it's a requirement for both licensure and reimbursement.
We want to be here for you throughout your career for all of your certification needs, and we're committed to making that as simple and easy as possible.
My name is Felissa Caserta. I'm an acute care nurse practitioner at the Johns Hopkins Hospital in the Neuroscience Critical Care Unit, and I am also part-time faculty with the Johns Hopkins University School of Nursing. I enjoy my career because I'm able to take care of patients and also help bring new nurse practitioners into the profession. When it came time for me to choose what organization that I would get certified through, the ANCC had the best reputation. They'd been around a very long time.
My name is Mylene Kedrock, and I am a family nurse practitioner in a family practice located in a suburban area. Hello. Hi. I have a special interest in women's health and adolescent care, so that probably makes up the bulk of my practice. It is important that nurse practitioners are certified because we go to different schools all over the United States. And it's important that the public know, that our employers know, that our colleagues know that we have all met this standard of practice. And since the ANCC is so widely known, our employers and our colleagues understand that this is a good exam, that if we've passed this exam, that we're ready to practice.
Our exams at ANCC go through a rigorous process of development. First, we work with content experts in the field to develop the exam, as well as with our measurement services department, who ensures that we have a psychometrically sound and legally defensible exam. When an applicant has passed an ANCC exam, it's well known in the field through regulation and employers that they have passed one of the most rigorous, highest quality exams available.
Carissa Morenci is a brand new nurse practitioner, and she was one of my students. And so when it came time to hire a new nurse practitioner, I chose Carissa, and she is fantastic. She is very competent clinically, very compassionate, very dedicated, and just an all-around wonderful nurse and nurse practitioner.
I felt that I had spent so much time picking a good job that would train me to be a nurse, and I spent so much time picking a good school to train me to be a nurse practitioner. And all the nurses and nurse practitioners that I looked up to as mentors, they were all ANCC certified, so it just seemed like if you're working so hard to get there, that this was an important step to picking the right group to give that certification.
One of the things I usually tell people when you're interpreting, whether it's a chest x-ray or when students first graduate, they're very anxious to get their first job. And they will go to their faculty and say, can you please be sure that you fill out the paperwork that's needed for the certification? Well, what's wonderful about the ANCC is that paperwork is streamlined. It can be done electronically, and there's an electronic signature, and that helps the faculty because it's not a pile that's sitting with a lengthy process.
ANCC makes applying for certification easy. You go to the ANCC website to your specialty page, which mine was acute care nurse practitioner. It's convenient because everything you need to know about applying for certification is all on one page. It's really nice because you can do all the paperwork before you graduate, so as soon as your school sends the transcript to the ANCC, you can sit for the exam. To prepare for the test, I went online to the acute care nurse practitioner portion of the ANCC website, and on there they had a test content outline which covered all the subjects that were going to be on the test, and I really used that to help guide my studying process. And then they also had sample multiple choice questions. They grade you at the end, and that really helped me see the types of questions that were going to be asked and how to best answer those questions.
ANCC offers a variety of resources to help advanced practice registered nurses to prepare for certification. ANCC's Institute for Credentialing Innovation offers seminars, teleconferences, online courses, review manuals, and additional question and answer sets for purchase.
After I got my letter stating that I could sit for the exam, I went to the Prometrics website to schedule my exam, and I just put in my zip code, and they gave me about 10 testing centers that were close to where I live. You can click on the testing center you want, and they give you options of dates and times. The day of the exam, I got there a little bit early. I was nervous because it's a big test, but I did feel very prepared to take it. It was 175 questions, and I think I had 3.5 hours to take the full test. And when I was done, they printed off my results for me, and I passed.
Hello, how are you?
Wonderful.
So you finished your cardiac catheterization, and they did find that you have 2 vessels that
What I really appreciate about the ANCC is that once you take the certification exam, that's not the end of it. There is a required renewal. And to me, that's really important. It shows that that nurse practitioner is staying on top of the most current evidence-based practice.
After I did the exam and became board certified, the ANCC kept in touch. They'd send regular mailings to remind me that I was going to need to renew my certification. But they also offer opportunities for me to get my continuing education through them so that I don't have to panic or worry about how I was going to get it done. I've also recently discovered that as you get your credits, you can go to the ANCC website and enter it. It's right there, all laid out for you, so it makes it really simple when you go for renewal.
We make the renewal process here at ANCC as seamless as possible for you. Everything can be done online. Most APRNs renew by documenting at least a minimum number of practice hours and professional development, which can include continuing education, academic credits, presentations, publications and research, precepting, and professional services.
I always recommend that my nurse practitioners become credentialed through the American Nurses Credentialing Center because the process is very easy, they have a great reputation, and that credential of itself really sends a message to the community about professionalism.
High five. All right. I'll see you later.
I would recommend ANCC for certification because they're so widely accepted. They're accepted in every state. They're accepted by Medicaid, Medicare, other insurance companies, and they're just widely known throughout the hospital in the nursing profession.
Hi Lisa, how are you? Hi. Okay. I recommend the ANCC because they have cushioned and supported me as I go forward as a family nurse practitioner.
ANCC is uniquely positioned to meet not only today's needs, but we have mechanisms in place to gauge the future and to adapt ourselves as we move forward.
We realize that there will be an incredible need for more advanced practice nurses. We stand ready to meet your needs as an advanced practice nurse so that you're credentialed and ready for practice.
I have been an ANCC board certified acute care nurse practitioner for 8 years.
I have been an ANCC board-certified family nurse practitioner for over 5 years.
I've been an ANCC board-certified nurse practitioner for 3 months, and I hope you join us.